Good evening. My name is Cordelia Padua. I am a DMP student at Brandman University. Tonight I will present my signature paper for Dr. Clary, NURU 641 for psychopharmacology, case presentation on Wellbutrin. Medication overview. Bupropion, also known as Wellbutrin, is classified as an antidepressant that is used for treatment of depression. It improves mood and feeling of well-being. Drug may also be used to help to quit smoking as well as treating ADHD. May also be used to treat anxiety in people with depression. This drug works by helping change certain chemicals in the brain, which is referred as neurotransmitters. Common side effects may include dizziness, sore throat, shaking, nausea, vomiting, rapid heartbeat. Safety monitoring may include creatinine and blood pressure at baseline, worsening of suicidality, alteration in behavior, changes at onset of medication. Patient education. Medicine is taken orally and may be taken with food. If stomach upset occurs, swallow medication whole. Do not crush or chew. No alcohol with this medication. Provider should know if a patient has history of seizure, liver disease, or bipolar disorder. Case study number 1. Chief complaint. Pam presented with complaints of depression that has persisted for a few months. Pam indicated that she has not entirely been compliant with the medication regimen. She states, I tried to see if I can do without this medication. I don't like what it does to me. Patient reported to hospitalization for attempted suicide. Because of the severity of her depression symptoms, her PCP referred her for psychiatric intervention. History and physical. Pam is a 62-year-old African-American female who is currently divorced after 32 years of marriage. She now lives alone. The couple had 2 children who live outside the state. Pam's husband left her and married her best friend after a bitter divorce. Pam was managed with Lexapro 20 milligram, which she admitted was not taken every day. She admitted to using OTC sleep aid medication for insomnia, which she said did not help her. Her lack of sleep has resulted in worsening of her diabetes. Medical history is positive for diabetes, heart disease, and obesity. Abnormal assessment findings, diagnostic criteria. Mood is 8 out of 10 for sadness, increased suicide thoughts. Medical history of diabetes, heart disease, and obesity. Social history, she drinks 2 glasses of wine with meals a week. Feelings of suicidal thoughts, hopelessness, loss of interest in activities, withdrawal from friends and social interactions, sleep and appetite problems. Diagnosis. Pam is diagnosed with major depressive disorder, rule out adjustment disorder, or situational depression, which is the depression that occurs due to traumatic life events such as divorce. This is different from clinical depression. Both depression and situational depression manifest in similar ways. Differential diagnosis for Pam is anxiety. Developmental and social history for Pam. Patient grew up in a stable homestead. Patient consumes 2 glasses of wine a week with meals. Negative for smoking, negative for illicit drug use. Case study. Plan for treatment and case formulation. Pam should start Wellbutrin 100 milligram orally every morning, increase 7 days to maximum of 300 milligram per day. Labs needed CBC, CMP, TSH, vitamin D, B, folate. Stop OTC sleep aid. Start Lunester. Initial dose 1 milligram orally once a day immediately before bedtime. Maintenance dose 1 to 3 milligram orally once a day immediately after bedtime. Maximum dose is 3 milligram. Stop Lexapro 20 milligram. Titrate to 15 milligram, then to 10 milligram, then to 5 milligram, then referral for psychotherapy. Case study number 2. Chief complaint. Jane presents today with symptoms of anxiety such as lack of sleep, poor appetite, sadness caused by constant worries about her son in jail. Jane is unable to work due to disability from medical condition, seizure disorder. Jane is a 48-year-old African-American female, presents with an anxious mood, sweaty palm, unable to relax. Current episode is 8 out of 10. Jane's current symptoms are consistent with generalized anxiety, depression, had poor response to Wellbutrin, had no previous suicidal ideation history. Her anxiety disorder started in college. Testing anxiety started in high school and continued to college. Depression started 2 years after her son went to jail. Abnormal assessment findings and diagnostic criteria. Jane presents with the following symptoms that are consistent with anxiety disorder: irritability, fatigue, lack of sleep, sweating, poor concentration, and nausea. She exhibits excessive fear or worry that triggers muscle tension and feeling of loss of control. In severest cases, Jane's anxiety disorder can cause major upset in her ability to perform even simplest tasks, making living with anxiety an almost impossible effort. Medical history positive for seizure disorder, managed with carbamazepine, which she has taken for 20 years for epilepsy. Her seizure was well controlled with this medication. Jane is obese with weight gain of 20 pounds in 2 months. Her depression has not been well controlled with Lexapro, PCP added Wellbutrin. She reports she sleeps 3 to 4 hours most nights. Sleep deprivation has a negative effect on her abilities to function well physically and mentally. Differential diagnosis is depression, developmental and social history. Patient grew up in a broken home, parents divorced at age 12, son diagnosed with ADHD in grade school, had run-ins with the law, negative for alcohol use, negative for smoking, negative for illicit drugs. Plan for treatment and case formulation. Jane should stop Wellbutrin for depression, provide education on contraindication of use of Wellbutrin as it increases the associated risk of seizure threshold on patient with a medical history of seizures. The patient will be treated with benzodiazepine or lorazepam. Dose 2 mg per day, given BID for anxiety. Patient has previous diagnosis of depression and recent issues of anxiety related to recent son's sentence to prison. Patient will be on 2 psychotropic medication management for depression and anxiety. Due to the past seizure history, Wellbutrin will be stopped and benzodiazepine will be given. Jane may also consider Zoloft with increased depression. Evidence-based decision-making. Starting Wellbutrin, there is evidence to support that the use of medication for major depressive episode will decrease the symptoms of sadness and depressive mood caused by recent life event for a patient. Early initiation of Wellbutrin is as a standalone treatment for depression is believed to be one of the safest medication to try first. Stopping Wellbutrin. Clinical studies show that 4 out of 1,000 people taking Wellbutrin experiences seizure disorder. People with history of existing seizure disorder are at greater risk of developing seizure with this medication. Overall, encounter and patient teaching. Both patient encounter was positive. By reviewing evidence to support continuation of Wellbutrin for Pam to manage her depression, as it is one of the safest medication to try first. Discussion of risk-benefit factors to ensure optimal use of medication. Pam will be taught the importance of creating a healthy social network. Lessons learned and summary of conclusion. Wellbutrin is a fantastic medication that can be used for smoke cessation, ADHD, bipolar disorder. Research illustrated that Wellbutrin is among the most safest drug that should be used by patients for diagnosis of depression. Additionally, this will be Because all the symptoms manifested by Pam and Jane are consistent with those of individuals affected by depression and anxiety, as such, it is expected to use Wellbutrin, and supportive non-pharmacological intervention will address Pam's healthcare needs. However, Wellbutrin is inappropriate for Jane since it is associated with risk of seizure threshold and a patient with past medical history of seizures. Cultural diversity application. Culture and diversity factors have a great impact on how medical practitioners make decisions affecting their clients in healthcare environment. Due to their ethnicity, they stated that they both felt comfortable having their physical examination executed by female nurse practitioners. Also, the patient also made decisions on their treatment only in the presence of female head nurse. Cultural competent care can improve patient quality and care outcomes. For questions and answers, feel free to reach me at my email, and below are my references. Thank you for listening.